Once upon a time, we used to do the most ridiculous things in emergency medicine, such as masked trousers. Anybody remember these? Tell me how you can say medical anti-shock trousers with an absolutely straight face. So they were these pneumatic pants that they would put on patients who were in hemorrhagic shock and then pump it up full of air, and it would displace all of the blood from the lower half of the body to press it up into the upper part of the body. And the idea is that it would keep the patients alive long enough to get them to the hospital and surgery where they could fix whatever was going on with the patient. But in time, we realized that really it just caused a lot of harm to these patients and no good at all. So we got rid of those things. Another ridiculous thing we used to do is every single patient, even if they only had minor trauma, this was still going on when I was a new ER nurse, every single trauma patient would come into the emergency department with blocks and duct tape across their head, keeping them fixed to this long spine board with absolutely no movement. Again, we realized through multiple studies that this was not good for patients. Let's talk about how patients used to be intubated. They were all always flat, or worse yet, the physician would crank up the bed to a high top table height and then Pez dispense to the patient and try to intubate them, and they said it gave them a great view. But we realize now that ramping and properly positioning your patient to get that ear to sternal notch airway alignment gives us the best chance of first pass success. Remember the days of bilateral 16 in the ACs and 2 liters of room temperature normal saline going in with full pressure? Yeah, we realized in time that doing that with our trauma patients further exacerbated hypothermia, acidosis, and coagulopathy, which are the 3 corners of the trauma triad of death. So while we look back and reflect on some of the ridiculous things we used to do because we thought they helped patients, but in reality they harmed them, can you predict what is it going to be like 10 years from now? What are we doing now that we look back and go, oh my gosh, I can't believe we were doing that?